हमारे समाज में अभी भी इन्हेलर को लेके काफ़ी टैबू है, एक स्टिग्मा है कि इन्हेलर नहीं लेना चाहिए, उससे उसकी आदत पड़ जाती है. Hello everyone, I am Dr. Sumit Singhania. I am a consultant in chest medicine at Kokilaben Dhirubhai Ambani Hospital at Mumbai. Today I am going to talk about a very common chest condition called asthma. As you all know, asthma is a very common condition in which patients get recurrent episodes of cough, chest tightness, breathing difficulty, and whistling sound from the chest. First, we need to understand what exactly asthma is. So, an asthmatic patient has more sensitive airways than a person who does not have asthma. And why this hypersensitivity of airway happens is because their air tubes are having a low level of inflammation inside them all the time. Or you can, in other words, you can say a certain amount of swelling is there in those airways. And every now and then this sensitive airway becomes squeezed, and that leads to breathlessness. Most asthma patients do not have any underlying reason why they develop asthma. There is some hereditary component, which means that if you belong to a family where there are multiple patients with asthma, then your likelihood of developing asthma is higher, but that is not an absolute rule either. There are certain occupations in which asthma is common, like painters, welders, and so on, or any exposure to certain type of chemicals, but that forms a small proportion of total asthmatic population. Until few years ago, the asthma treatment was in the form of oral medication. And these medications used to cause a lot of side effects in form of tremors, palpitations, weight gain, cataract, and so on. But over the last 2 to 3 decades, asthma treatment has evolved in a great way. And we have this wonderful way of treating the asthma in the form of inhalers now. Inhalers ensure that the maximum amount of drug gets deposited in the target organ, which is the lung, and that leads to decreased absorption of these drugs inside the body and limits the side effects that you can get because of medication. Also, asthmatic patients require quick relief of their symptoms. So as compared to an oral pill, an asthma inhaler will give you far quicker relief and far more effective relief from asthma symptoms rather than a pill. It is important that you discuss your asthma treatment with your physician and choose a device according to your convenience and as per suggestion of your physician. You should learn how to use the inhaler correctly, because that is one of the most important aspects of asthma management. Also, if you've been suggested to take the inhalers on a regular basis, then you should continue to take your inhaler on a regular basis, irrespective of the symptoms that you have. Even if you don't have symptoms, as I mentioned earlier on, that some degree of airway inflammation is still going on, and you need the inhaler to prevent this inflammation from becoming too much and then start causing symptoms. You can compare asthma with long-term conditions like diabetes and hypertension, and you would see that all these patients with diabetes and blood pressure will be taking their medication regularly, irrespective of what their sugars levels are or what their blood pressure is, because they know if they take these medications on a regular basis, they will be able to prevent the long-term complications of uncontrolled sugar or uncontrolled blood pressure. And the same lies with asthma as well. Otherwise, a long-term untreated asthma can lead to breathlessness, which may persist and may become irreversible during the later half of your life. Other important aspect of asthma management is to avoid smoking. Smoking in general is not a good thing to do, and with asthmatic patients, it's all the more risky to continue to smoke. So, in a nutshell, I would like to suggest that all patients who have symptoms suggestive of asthma should meet their physicians and get on with the treatment and don't shy away from inhalers. हमारे समाज में अभी भी इन्हेलर को लेके काफ़ी टैबू है, एक स्टिग्मा है कि इन्हेलर नहीं लेना चाहिए, उससे उसकी आदत पड़ जाती है, या उसको हम एक कमज़ोरी की तरह देखते हैं कि ये इन्हेलर ले रहा है, एक कमज़ोर इंसान है या बहुत डिपेंडेंट इंसान है। वैसा कुछ भी नहीं है। इस टैबू के कारण कई हज़ारों एस्थमेटिक पेशेंट्स का बहुत नुकसान हुआ है। इसलिए हमें इस अंधविश्वास से ऊपर उठना है एंड वी हैव टू यूज़ दिस इन्हेलर्स विथ a full confidence that these are there to help and not to shy away from.